I'm Simi Sanda, and I'm a behavior therapist by profession. I completed my bachelor's degree in mental retardation from the National Institute for Mentally Handicapped, Secunderabad, and then further took up my master's in psychology and moved to the States in 1998, where I started specializing in applied behavior analysis. And ever since, I have been working in the field of autism spectrum disorders in USA and Canada. And currently, I'm here hoping to bring the state-of-the-art kind of strategies and techniques used in the West to India, and especially to Kerala, to provide services for the autism spectrum disorder children, individuals, and families. So that is who I am, and I have here Dr. Nichola, who is a behavior analyst from Canada, who is also here on the same purpose to help support the dissemination of applied behavior analysis in India. Welcome, Nicole.
Thank you very much, Simi. I'm happy to be here today and talk with you a little bit about autism. I think it's important that we spread the word and get people aware that autism exists and that there is help and that there is support for people with autism spectrum disorders.
Nicole, I would like to let the people know about your experience and your background in this field. So if you could please introduce yourself.
Sure. My name is Dr. Nichola. I studied at Columbia University in the United States, and I have a PhD in applied behavior analysis. I've worked in the field for about 25 years, working both in classrooms and in treatment centers. I have worked both in the United States and in Canada, and I've been fortunate enough to travel to many different places. This is my first trip to India, so I appreciate very much having an opportunity to come here and to work with Simi here in India.
Thank you. So I think maybe we should talk a little bit about what autism spectrum disorders is all about. And by definition, we can say that autism is a neurodevelopmental disorder, and the characteristics of individuals with autism is significant delays in speech and language development, and they will also have delays in the area of social skills. So basically, communication and social are the two areas that are affected in children and individuals with autism spectrum disorders. In addition, there will be more of a repetitive kind of behavior, or a stereotypic behaviors can be seen in these individuals, and also sensory sensitivities, meaning to say that they may either be very sensitive to noises or lights and various senses, all the inputs that they receive from different senses, they may be sensitive to it. So these are the basic characteristics that we look for in children and individuals with autism. Would you like to add something?
Yeah, I think one of the things that's important to remember is that there are certain developmental milestones that occur when a child is born, and it's very important to be mindful of some of the things to keep an eye out for when your child is born.
That's right.
Around 18 months of age, a child should begin to be making some sounds, maybe babbling. There may be some actual words occurring depending if it's a boy or a girl. They may be, a little bit later than 18 months, but around 18 months, your child really should be engaging in some kind of interaction with you, using some kind of communication, especially some sounds.
That's right.
And in addition to that, you should see a child at that age and even earlier really making good eye contact with mom, with dad, discriminating between someone that they're familiar with and someone that might be a stranger. There should be some social interactions occurring. Those might not all be verbal, but it's very important that you start to see some of these kinds of things.
That's right.
If you don't see them, that's a really important time for you to take your child to see a physician. A physician is kind of your starting point for the assessment process, and it's important that as early as possible, if you don't see those developmental signs occurring, those developmental milestones happening, that you really get to that assessment process or get somebody to start to take a look at your child. It's important to realize that there's nothing that you're doing wrong. It's simply that the child may not be meeting those milestones, and you want to make sure that someone starts to take a look at that with you, someone who's a professional and someone who's trained to look for those signs.
That's right. And here I think more specifically we need to understand that a child with autism is differently abled, meaning to say that we should not necessarily think that there is something wrong with this child, but the way he or she is adapting to his environment and the way he is taking the inputs are different from any other child. So professional help is going to help the family in empowering themselves with the necessary knowledge base, which is very important. So parents and caregivers and family members being on board with this condition is quite important.
Mm-hmm. Absolutely, I agree with you, Simi. And I think the other thing too to be mindful of is that as a mother or as a father of a child, any child, you have a sense of whether or not your child is behaving similarly to those around you.
That's correct.
You have a sense of whether your child is really there with you or not. And if you start to get that feeling, if you start to have a sense that, you know, my child is not behaving exactly like the kids I see at the playground or that I'm noticing in, you know, when I'm out and about, those things are things that you shouldn't ignore. And
Most
really
certainly.
you want to look for a professional who's going to be helpful and help you to find what you need to help you with the child. It's very important that if you see a physician initially and they say, oh, he'll grow out of it, don't worry about it, he hasn't talked, he's 4 years old, he's still not talking, it's important that you persist.
That's right.
And that you know in your gut that this is the wrong thing, that you need to find a physician or a professional who can really make a difference for you and can really help to understand what you're going through and what you know to be right for your child.
Most certainly. And research from many years have shown us that early intervention is critical in development of the key skills. So basically what we are looking here is an individual or a child with abilities that are different from others on one hand, which are supposed to be celebrated, and on the other hand we have some gaps that need to be filled. And the earlier a professional works with this child to fill the gaps, the better for the individual, and it will go a long way with the child for him to be maybe outgrow the condition even. What do you think about?
Absolutely, I agree. I think that what you're looking for in terms of some of these challenges would be the child who's having difficulty playing with others, child who's having difficulty playing by themselves.
That's
you don't
right.
see the emergence of pretend play.
Right.
If you have a child who is not talking or who may be talking just a few words where his peers or his fellows are speaking in full sentences. If you have a child who's not socially interactive, who prefers to be by himself and maybe doesn't want to join the group.
Right.
If you have a child who maybe has repetitive behaviors, like you said, lining up cars, playing with toys in a specific manner, a child who has difficulty with changes in schedules or routines, who
Right.
gets very upset. And when they get upset, they have a really long period of time that they're upset. They might be really having lots of tantrums, might be throwing themselves on the floor, crying, and getting extremely distressed. These are all signs that you really want to pursue and look for. And as you said,
Right.
the early intervention piece is really critical. So getting to a physician, getting to a psychologist or a psychiatrist who can give you that assessment, go through that process with you. If you do get a diagnosis of autism, then really being proactive about getting out there and getting some kinds of services. The earlier, definitely the research does show that the earlier you intervene, the much more successful you'll be in terms of making a change and really making a difference for that child and for that for your whole family.
Most certainly. And Nicole, here I would like to mention about the different professionals who come to play. So definitely the starting point is to go to a physician or maybe a clinical psychologist, a rehab psychologist, a psychiatrist who possibly is going to give you a proper good diagnosis of what the condition is. In some cases, the child may be simply having an autism spectrum disorder. And again, we have to understand that it is a spectrum disorder. So the severity may be, he may be very severely autistic or he may be very mildly autistic. But at the same time, if delays in different developmental milestones are also observed in this child, then there is a possibility that he has a comorbid condition, meaning to say that he has a global developmental delay, for example, along with the condition of autism. Or maybe he has attention deficit disorder coexisting with autism. So in any case, we need to understand that it is not just one professional who can provide all the services. So in this case, maybe we may be looking at speech language pathologists, We are looking at occupational therapists who can possibly work with the sensory sensitivities. We may be needing a physiotherapist in some cases if there are motor delays. And we also, most importantly, it is a behavior therapist who practices applied behavior analysis in a proper manner, which is the most evidence-based practice till date in helping individuals with autism spectrum disorder overcome their challenges or the gaps. Maybe we should.
And that's really our area of expertise,
That's
right?
right.
I mean, that's really what we focus on
That's
is the behavioral aspect and what we can do to help make changes in behavior. We can't cure autism, we don't fix autism or change it, but we can teach a child to become more independent, to gain more skills, and to be able to be more successful in their community and to work with their group, with their family.
Right.
So that's a big part of what we focus on as behavior analysts is how can we help make those changes? And that's a big part of why the early intervention component is so important. If you're working with a child who's 2 or 3 years old, you can have a much better chance of teaching them how to dress themselves, how to eat properly, how to follow directions, how to follow a classmate, and how to be in a classroom successfully as they get a bit older and go into classrooms, of course.
Right.
But really, it's that early piece, getting in there early and teaching the family as well. The child may not learn the same way that other children learn, and so it's important to be mindful that the learning style has to be adapted to. We have to adapt what we do to that learning style, and that's really where we focus, and myself, and I know you too, that's really what we think about and what we really focus on in terms of making a change for that child.
Exactly. And here again, we need to mention about the importance of knowing the individual really well, because as all of us are different, so is an individual with autism spectrum disorder, and no two individuals with autism spectrum disorder are the same. So we need to understand the person that we are working with in a complete, comprehensive, holistic manner. What does he have any medical conditions that require medications probably, or does he have any sensory sensitivities? If he's indulging in any behavioral problems, why is he doing it? Get to the core of it, do a functional behavior analysis to find out what is the function of the behavior, what function is it serving? Is this individual having a difficulty communicating his needs, so it's appearing in the form of a behavior problem? So understanding the individual very well is very critical, and the first step basically in the treatment plan that we can come up with. And then adjusting the environment maybe. In many cases in the West, what we see is that the school adapts itself, the classroom adapts itself to the needs of the child, and that way we are catering to the different ability that he has, helping him come up with his potential.
Well, and you bring up a good point there, Simi, and that is that individualization. One, that's a hallmark of applied behavior analysis, is that you individualize your treatment to the child, because as you said, they're all very different. And the other piece that you brought up that I think is important to make a point about is that, for example, the school changing, the environment changing to fit the child, to help the child to adapt. And that's something that really comes when the family and the community understand how important it is to accept a child with autism and make accommodations.
Sure.
The child, we're working with the child to teach him to fit into the society or teach him to fit into the community. At the same time, the community kind of has to meet him halfway.
Sure.
And I think that parents become very, very important in that aspect.
Right.
As you said, they are one of the experts on their children. We might be experts in applied behavior analysis, but they're an expert on their child, so they can bring that information to us.
Sure.
We can individualize their treatment. They can individualize what they do at home because they know them so well, as you said, it's such a critical piece. And then they can really start to advocate for their children in their community. That's a very difficult process, especially if a family isn't really willing or ready to accept the fact that their child is differently abled, to accept the fact that their child has a disability of some kind or has a difference of some kind, that they have been diagnosed with autism, and this is a label that is not a bad thing. It's simply a way of understanding how this child might need some different supports and better supports in some ways.
And inclusion is the word today. And I think it is their right. I mean, there is no other way to go. We have to accept everyone, just as we are accepting each other with our abilities and inabilities. I may be not able to sing, but maybe I'm good at something else.
Right.
But you are tolerant of me, and you're okay with accepting me the way I am. The same way, it is very sad to see that many of our friends with autism spectrum disorders are not necessarily included or accepted the way they are. They are isolated. They are, not only them, but their families are isolated because nobody wants to see a child with behavior problems in their neighborhood, or they don't want them to bring them to certain functions, and they themselves feel so not okay to bring this child out. So accepting, if not the family, who else is going to accept this child born in your family?
I agree.
That is step number one, right?
Absolutely, absolutely. I work with a lot of families in the West, as you said, in both in Canada and the U.S., and one of the things that we really have had to focus on is, for some families, getting past that sense of you know, shame and that sense of grief, that sense of guilt.
Right.
Is it my fault? It absolutely is not their fault.
Right.
It simply is something that happened. So that, and then they go into, let's say, for example, into a grocery store, and their child is flapping their hands, and they're falling on the floor, and other people are looking at them and saying, oh, you're a bad mother, you can't control your child, there's something wrong. And the difficult thing about a child with autism is they look the same as everyone else.
Exactly.
And yet, how does this mother deal with the fact that everyone's looking at her and saying, oh, you're a bad mother, there's something wrong with your child? You know, it's a very difficult journey that families have to take. And I think that one of the things that's really helpful about doing, you know, things like this, where we start talking about it, is that it starts to get the word out there. And it lets families know that they can start to move past that. And if they can move past that, then they can start to get a change and make a change and get help and get the supports that they need.
Yeah, you're very right, Nicole. And I guess those are some of the points in conclusion that I would like to say here, is that first and foremost, please accept the child born in your house who is differently abled. Step number one, parents have to, I know that when a physician, the way they present it to you makes a lot of difference. So even if they are talking in a way that is not very encouraging, the onus lies on you, mother and father, to please empower yourself with the appropriate knowledge. The knowledge base is going to help you to understand your child really well, and then eventually you have to become the advocate for your child, because step number one is you accepting your child the way he or she is, seeking the necessary professional help as early as possible without being ashamed of doing so, and being proud of the special abilities that your child has. And then the next step would be to be an advocate for him or her at every step of his life, because this is an individual who is not able to properly communicate properly, because that is one of the characteristics of his condition. That doesn't mean he doesn't possess any talents. The skills that he has is something that you have to identify and help him realize. In conclusion, Nicole, a few words from you.
I just want to say that I agree very much. Dr. Kiran Bedi said something that I think was really powerful, and that was, she suggested that people need to get together. They need to talk to one another. They need to support one another, not just on a national level or global level, but also on the individual level, at the neighborhood level.
Most certainly.
You know, getting together with one other parent really helps you to feel that strength that you need to empower yourself, to advocate for your child. And talking to 3 families, moms getting together over tea. Just a small group of 5 people can make a huge difference and really begin that process. And then 5 more people might join, and then 5 more. And as it becomes a larger and larger group, the strength of that group really increases with the size of that group. So I definitely encourage you have to start at the first level, the first person, and build on that group. Really encourage people to get together and talk to one another about this.
Most certainly. Thank you, Nicole.
My pleasure.